thinking about support for relatives of people with dementia. Well, unfortunately, it's not that uncommon for people to feel or find themselves feeling unsupported following a diagnosis of dementia. It is difficult for the person who's diagnosed with the dementia, but actually, I sometimes feel it's even more difficult for the relatives, particularly if they are the ones who are more acutely aware of the problems and the implications of the diagnosis. So we do have a number of memory services, or in some areas, memory services will make a diagnosis of dementia and then discharge the person shortly afterwards with that diagnosis, perhaps on some cognitive enhancing medication and some signposting to local areas, local organisations and services that can support them. I think because it's such a common condition, services can't always offer ongoing follow-up if the dementia isn't complicated by other very challenging symptoms. So with this in mind, it's really important, I think, for people to just not feel too lost and be aware that there is still a lot of support available out there. There are three main organisations, charities, which are excellent sources of information and support and have local teams that operate. So these are Age UK, the Alzheimer's Society and Dementia UK. So the kinds of things they can do is the Alzheimer's Society has dementia advisors who can meet with the person who's been diagnosed and family and support with those practical things such as a lasting power of attorney, thinking about care, thinking about sitting services, those sorts of things. They will also know about and sometimes run dementia cafes and carers groups in the local area. Dementia UK offers virtual clinic appointments with specialist dementia nurses who are called Admiral nurses. They're similar to Macmillan nurses who are involved in cancer care. As a dementia progresses, care needs and symptoms kind of change, and the challenges associated with the dementia change as well. I mean, things don't necessarily get worse. Sometimes challenging symptoms of dementia will improve as the dementia progresses. But when by definition, progression of dementia leads to someone having functional and more cognitive impairment. And as this happens, they are likely to require more support with activities of daily living. So if it wasn't needed when the dementia was first diagnosed, they may need a referral to social services. This can be done either by the relative who can self-refer or via the GP. And there are also private care agencies who will arrange assessments for care and be able to provide carers. These are things that can help to reduce carer stress. I mean, I think it's really important to just talk about and acknowledge the amount of carer burden in dementia, because it's often, it's often a relative, a very close relative, who's trying to provide care, which can be challenging, to someone that they are very close to, but as well as having to provide sort of care, practical care, sometimes very, personal care. They're doing that whilst they're also facing sort of the loss, really, of the person that they once knew. So it's really challenging, and particularly when if they're feeling unsupported they're just feeling that there's not much around to support them, and if there are what I would what we call behavioural and psychological symptoms of depression, which can include, of dementia, sorry, which can include agitation or aggression. I mean, it's an extremely difficult situation. So if you're caring for someone at home, then there are also things that can make it easier. So, for example, it's called assistive technology, but things like a GPS tracker watch, a pendant alarm, so if you go out and the person falls, they can alert someone, or sensors on the door if the person is at risk of wandering and getting lost. So there are things that can be done. And I would say that consideration to introducing external carers, so a package of care, earlier rather than later, is very important, because one, by doing it earlier, the person may be able to sort of accept it more easily and develop a relationship and get into that routine. But also, there is something really important about trying to preserve, for example, a spouse trying to preserve their relationship, their pre-existing relationship with their partner, and maintaining or reserving some emotional energy to be able to do that and still have quality time together, rather than just spending all of their time being, getting completely worn down by being the one carer for their relative. So introducing care, and then just a couple of other things. I think that people need to remember that just because a relative has been discharged from a memory service or an NHS service, it doesn't mean that they can't be re-referred. So if there are new challenges, it's important to revisit the current care and treatment plan with re-referral to a dementia specialist or an older people's social services or mental health team. And I think I've already touched on this, but in terms of carer burden, behavioural and psychological symptoms of dementia, so agitation, refusal of care, aggression, low mood or psychotic symptoms are really, really distressing for carers as well as for the person with dementia. So if these symptoms are present, it's important to seek further mental health support, because a lot of these symptoms are treatable, and if they're treated, it can make the difference between someone being able to stay at home and be cared for at home, rather than needing either a hospital admission in some cases or care home placement.